What you want, when you want it, where you want it. This is The Mesh.
More than 275,000 Americans die each year due to medication mismanagement, and 750 older adults are hospitalized every day from medication-related harm. And on average, individual Americans waste about $6,000 a year on unnecessary medications. Today we'll take a look at overprescribing, medication safety, and practical advice for caregivers and their loved ones on how to manage this healthcare crisis. Stay with us. We'll be right back.
I used to think healthcare was all the same until I discovered Pace at home. Now I can come to a place to stay active, see the doctor, or just enjoy a meal with my friends. Plus, having a team of people that help me make sense of my options gives me the support I need to stay in charge of my own health. It's been life-changing.
With Pace at Home, we offer a unique lineup of personalized care and a caring staff that feels like family, all under one roof. Call today and discover a community of caring delivered at your own pace.
Welcome. I'm your host, Karen Summey with ACAPcommunity and an active family caregiver. If you're listening to our premiere broadcast, today is Friday, January 2nd, 2026 at 12 noon Eastern Time. Happy New Year. We're delighted to have you with us. Today we're talking about a healthcare crisis that comes from overprescribing and mismanaging medications. My guest today is Dr. DeLon Canterbury, a board-certified geriatric pharmacist and president and CEO of Geriatrics, Inc. Dr. Canterbury graduated from the UNC Eshelman School of Pharmacy at UNC Chapel Hill in 2014 and spent years in traditional retail pharmacy before founding Geriatrics. His vision is to reduce over-medication of senior adults by implementing medication action plans and drug screenings for older patients in cooperation with their healthcare providers. His efforts in executing deprescribing protocols have saved families millions of dollars by preventing involuntary admissions to memory care facilities. Dr. Canterbury was voted as one of the top 50 most influential pharmacists from the Pharmacy Podcast Network in 2023 and is a recent recipient of the Advocate for Aging Award given by the American Society on Aging. Wow. That is a lot of accomplishment for a man still in his early years of his career, and we're delighted that you have agreed to return to ACAPcommunity for the second time in recent years, Dr. Canterbury. Thank you so much, and welcome.
Absolutely. It's my honor and pleasure to be here. Hope everyone's doing well. Thanks for having me on.
You bet. All right, let's jump in. Well, as a person who is getting older, and one who is in and out of healthcare facilities all the time for both myself and my loved ones, I am very interested in hearing what you have to say today about medications. I'd like to start for getting a feel for the scope of the problem. So in my introduction, I cited some data about the number of deaths each year from medication mismanagement, the number of people who are hospitalized or even committed to memory care facilities, and all the wasted money from overprescribing. And these are staggering numbers. Can you help us understand how we arrived at this place of overprescribing? How did we get here? And where's the waste coming from?
Yeah, no, thank you for that. And it's definitely a complex problem with a complex solution. But it's really years in the making of a kind of a behavior of us in Western medicine to always treat. And that is appropriate and fine and dandy when you're middle-aged. But when it comes to 65 and up in the older population, what we're seeing are the after effects of providers following what they're supposed to in all the guidelines, but it's not looking comprehensively at what an older aging adult is dealing with. And so what your kidney doctor may recommend and what your heart doctor may recommend aren't always going to mesh for an older adult who may have, less ability to break down meds, less absorption, less really more risk of side effects, more risk of potential harm. So over time, now you've got one doctor writing for 5 meds, another one for another, and well, you've got someone who's got 4 or 5 different doctors as we age, and no one is quarterbacking whether all of these meds are doing more harm than good. So it's a mixture of a practice of being trained in Western medicine to treat versus looking at the root problem or the holistic under the hood perspective. And then there's the behavior of, well, the fact that we're one of 2 countries in the world that allow direct-to-consumer marketing from pharma. So that means all those commercials you're seeing, the singing and dancing, us and New Zealand are the only countries on the world that allow that type of direct-to-consumer marketing. So it's goading people to ask about the newest and hottest drug on the market. So we're kind of trying to reverse all of that by using this world of med safety and putting in policies in place to make sure medications are aging friendly.
Well, I could unpack a lot of what you just said, and I want to just make a comment about the advertising, because I was in a physician office one day, and he said to me, I just had a patient come in and ask me for a medication based on an advertisement for stage 4 lung cancer. He doesn't have stage 4 lung cancer. And so the advertising apparently works, or they would stop doing it. But yes, I imagine it's very frustrating for healthcare professionals as well as everyone else when all of that takes place, and we're asking for things that really don't pertain to us or have any purpose in our own healthcare. So thank you for that. I appreciate that. Well, you've talked previously about polypharmacy, or people taking more than 5 or more medications at one time. And I think many older Americans are there. I just hit 5 myself, so I understand what that is. What percentage of older Americans are we really talking about with polypharmacy? And at what point does medication become more dangerous than the conditions that it's designed to treat?
Yeah. So it may vary from clinician to clinician, but on average, we're seeing about 40 to 50% of people 65 and up taking at least one potentially inappropriate medication. All right. So that means there's opportunity for us to potentially save them some money from stopping a script that's no longer beneficial to that patient's longevity. And really, when it comes to knowing when to act and advocate for yourself, comes down to being honest. And that's really, what's your body telling you? What's your loved one's body saying to you? Are you waking up having some pretty notable side effects or unnecessary fatigue or difficulty with bowel movements or maybe even incontinence? Some things that might seem vulnerable to talk about, but share that and share that with your provider. In the world of aging or geriatric medicine, the first rule of geriatric medicine is first assume that it's a medication. Once we rule out that it's a medication-related side effect, then we can assume it might be a new health condition or a new clinical, disease for us to manage. But in aging, the opposite approach holds true, where the old adage, less is more, can go an exponentially longer way than adding more and more meds.
Right. Wow. Okay. Well, that's very interesting because, in my own family, we realized at one point that there was a very serious symptom appearing, and it did not turn out to be a medication, but it was because a medication was needed, actually, for a UTI. I mean, there was slurring of words. There was just being very non-responsive and hallucinating. And we thought, oh, my goodness, they've had a stroke. Well, that was not the case. It was just a simple urinary tract infection. And when we got the medication, all of that went away. I could not believe it, but I know that the converse can be true as well. When we get too many medications, we can have symptoms of things happening that are probably the result of the medication. And we're going to talk a little bit more about that right now. So ACAP has a lot of programs on things like fall prevention, dealing with dementia, or just normal signs of aging in our parents and other loved ones. So how often are medications actually the culprit in these issues, and how can families distinguish between normal aging and the medication side effects?
Yeah, it's a great question, and not often easy to delineate the differences. And that's where it's super beneficial to have your aging rockstar team, whether it's your primary care provider or your fiduciary or an elder care attorney. You want to have professional experts in your caregiving care partner network to help you figure out some of those pressing questions. Now, you're going to know your loved one more than most of us, all right? But we as clinicians, our goal is to simply be your guide. You're the CEO of your health. So if you are seeing a significant change in someone, communicate that. If it's care related, if it's a clinical related thing. Now, yes, as we age, there are what we call geriatric syndromes, right? Sometimes your skin gets a little more dry. Sometimes your stomach doesn't absorb as much nutrients from food. There are natural processes that occur just because we get older. For instance, your blood pressure naturally climbs a little bit over the years. Your kidney function steadily declines over the years, et cetera. So there's some things we'll have to cross-check as professionals in healthcare, as, you know, is this a natural course of aging, or is this a side effect that's exacerbating a baseline issue? And as pharmacists, we're adept at figuring out the noise between, and sometimes it's both. It's just what it is. Sometimes it's a combination of both. And we find often it's multiple interactions, even with the smallest of medication lists. It could be a list of 5 or 25. If 2 things are causing a notable issue, pharmacists are trained to find it and at least hit the problem head on, stop the medication if appropriate with their provider supervision. And if that problem goes away, we can now confirm that it was a medication versus the natural course of decline in the patient.
Right. Okay. Very good. Okay. I want to just give one little statement to our viewing audience here, and that is that you should always consult with your healthcare providers before starting or stopping any medication. And Dr. Canterbury is very well aware of that and advocates that as well, but just wanted to make that very clear. Please don't take immediate action over things that you hear on this podcast today without consulting a healthcare professional first. Very important. Okay. So if a caregiver suspects that their parent or their elderly loved one is on too many medications, what should their first step be? So how do they advocate for deprescribing without alienating their loved one's doctors or other healthcare providers? What do they do?
Yeah, excellent question. It's oftentimes seen as a barrier, since caregivers and patients don't want to, quote unquote, offend their providers or come off a certain way. But ultimately, like I said, you guys are the CEO of your health. And until you tell us what's wrong symptomatically, I'm using the bathroom too much, my memory is going, I'm falling more often, whatever the case is, we have to at least lead with what's causing harm first. When a caregiver knows that there's an immediate harm, the first step is to know, okay, what is the medication list, first of all? So 1, have an accurate and up-to-date list that includes prescriptions, over-the-counter medications, along with any vitamins and supplements. You got to make sure that's up to date. So some people keep pill reminders, organizers, they have it on electronically. Keep an accurate list is the first step. Second, if you suspect something is off, ask your local pharmacist, give them a call or contact us with geriatrics. But if you see an issue and you want someone to review the meds, ask for it. Pharmacists are the most accessible healthcare professional in the community. And if you already have a relationship with your pharmacy, give them a call, hopefully when it's not too busy, and express those concerns. Lead with what's causing the most harm or side effects or symptoms first. Once you lead with that, we're able to hone in on, okay, based on what you've told me, this med is most likely contributing to that issue. That's what allows us to work together with the provider and come up with a plan, whether it's a medication change, a dose reduction, or simply stopping something altogether, and then assessing if the situation gets better once we stopped.
Right.
But it first starts with, don't be afraid. Just be your own advocate and allow other professionals to guide you along that, play a part in that role.
Great. Well, you've said some things that I want to key in on, and I'm going to kind of rearrange my order here a little bit, because one of the questions that I had for you this morning is, you worked in retail pharmacy for a number of years before you formed geriatrics, and I tend to ask a lot of questions, and so I really do view my pharmacist as my go-to person to ask a lot of questions of, because they are accessible, because they do have a ton of knowledge. And really, I consider that they have as much, if not more, knowledge about medications than the doctors do, than the physicians and the healthcare teams. And so I always wonder in my mind, am I bothering these pharmacists? They are so busy. It takes them so long to get things filled, and they're just overrun with work every day. And so how do pharmacists generally feel about answering patients' questions? And should we feel bad that we're wasting their time, or just assume that it's our right as a patient or a caregiver to ask those questions? How do we deal with that?
Yeah, I can definitely speak to that. Coming from that world, pharmacists are one of the best kept secrets in healthcare. And we literally trained and got our doctorates to talk to you. We love doing that. The problem is the setting and the environment isn't always as conducive for us to give that extra oomph of care. And frankly, that's why it eventually burned me out as a retail pharmacist and pharmacy manager. And I said I felt the setting didn't always allow for me to be the person you see today. Now, does that mean you're not going to get quality care by asking a quick question? Absolutely not. Pharmacists know their stuff, and it's even better if they're trained in geriatrics or aging medicine to better advocate for you. So do not feel guilty. Yes, the climate does portend doom and gloom, which we see on the news with pharmacy closures, pharmacy deserts, consolidations. I love mom and pop pharmacies. You don't really get that much of a rush from the drive-through, so to speak. And so they're more focused on the quality versus let's fill things as fast as possible, get you in and out like it's a drive-through at a fast food chain. Mm-hmm. So stymie that guilt. You're and frankly, we're actually required by law to offer and ask, are there any questions you have regarding this medication? That's a part of OBRA 90. It's a law passed for us to offer that up as a consult. So we love doing it. So I tell patients, if you're going to do it, make sure it's at a time that's not as crazy in the pharmacy, not drive hour. Maybe call a few minutes right once they open. It's usually a little bit quiet in the morning. Those are my tips to kind of get around that workflow. But yeah.
Okay, that's perfect. Thank you. And so we're going to come back to this, but we're going to jump back to another place for a moment. As everybody is taking all of this in, many people are going to recognize they're in a difficult situation where multiple specialists have each added medication without looking at the whole picture. In fact, that is one of my greatest concerns as both a caregiver and as a patient. How can caregivers help coordinate care and ensure someone is looking at the whole medication list?
Yeah, I believe care managers are one of the most underrepresented asset in the world of aging. And what I mean by that are there are experts in care navigation that know the landscape of aging. Some of them are gerontologists, some of them are nurses, some of them are just caregivers who decided they had a passion for it. But there is a world of what we call aging life care professionals who are privately hired by families who could do all of that thinking for you. So you're not trying to figure out how to plan medical visits. You're not trying to figure out how we're going to pay for this. They are the quarterbacks of aging. And so when it comes specifically to medicines, of course, you can reach out to geriatrics or myself and our team. We do medication audits. So we make sure you get some quick answers if there is a bit of a pinch, and we can help you in the long term. And so one of our key partners have been care managers in growing our practice. And they are the ones who, one, know the health system, two, they know who to call, they know who to turn to. It's like having your own social worker for your loved one is what I like to describe them as. But they're not beholden to an entity or a health system. They're beholden to what's best for you. So it's one of the best investments because aging requires a team, straight up. But when it comes down to just general care, the first step is demanding what you want. And if you want to be on less meds, or if you want to try a lifestyle approach, express that with your providers. Have that relationship. Make sure it's open-ended, because all the decisions made in care should be a shared decision with the caregiver, the patient, and the provider. So ask is the first step.
Yeah.
But I know, sometimes we as caregivers, it's not easy to ask because we don't know who to turn to and we don't know what resources are out there.
And you said aging life care manager. Is that an actual job title?
Aging life care professionals.
Okay.
The organization is called ALCA, which is Aging Life Care Association.
Okay. I'm writing. I want to be able to put this into our video notes after we finish our production. So, yes.
Yeah.
ALCA. Yeah. Okay. Great information to know.
Advanced care planning, you name it, the whole 9 yards. It's a great organization.
Okay. Perfect. So, what questions should caregivers or patients ask at every doctor's appointment to protect themselves or their loved ones from medication harm? What do we need to ask?
First and foremost, when you have that accurate medication list, make sure you're having a comprehensive medication review. So that means an appointment scheduled just to look at the medications. And our questions would be, of each one, is this specific medication vital for me to live? Is this medication important for my quality of life? If it's not vital or important for my life, then we may have an opportunity to have a de-prescribing conversation. Another good question I coach clients to ask is, what's the lifetime benefit of me taking this medicine? Do I need to be on this for 5 years to see a benefit? Will I see a benefit in a few weeks? And based on the literature, is this appropriate for me right now? Everything around meds comes down to what's the pros of me staying on something versus what are the cons or negatives of me staying on something. And so when we're having that open conversation with our providers, it creates clarity on what your patient-specific goals and needs are. And that is the core of healthcare, is getting to what matters most to the family.
Absolutely.
And if your prerogative is to be on less meds with lifestyle and diet, you can make that so. But lead first with, is this necessary? Is this going to save his life 10 years from now? Is this important for the quality of life? And if it doesn't really hit those 2-3 questions, then let's talk about, can we have to dose and see about a drug holiday? Can we take this off for a few months and see how the labs look? Will he still be sane? And will this be the same? So quality of life, quality of life, quality of life. Those are the key things in advocacy, is making sure that's clear to you and your provider.
Wonderful tips. Thank you so much. So let's add on to that question. So you've told us what we need to be asking at the doctor's office, at the appointment, the office visit. So when we walk away with a prescription, or when one is input into a system and sent to the pharmacy on our behalf, when we're at the pharmacy and we're getting those prescriptions filled, what should our patients or caregivers ask their pharmacist before they get those prescriptions filled, or before they are filling up those pill boxes at home? Are there a few practical tips you can offer on doing those things well?
Yeah, I think it's always nice to ask, what are the most commonly seen side effects with this? What are some things I need to look out for? What are some changes that could occur when my loved one? Would be good questions as well. How do we know if the medication is working? There's some meds it's working. There's some meds you have no idea. Another question would still be, how long do we need to be on this? Of course, that's more of a provider decision, but you can always ask a pharmacist, hey, what are your thoughts on my grandma taking this? She's already on 15 medications. Mm-hmm. Do you think this medicine is absolutely necessary at the age of 85, right? Is this appropriate for your loved one now? Mm-hmm. Is this an acute medication, or is it a chronic medication, right? Is this going to be long-term, or is it just be a short-term course? Good to know. Cost is also important too. Are there any cheaper alternatives if this is a pricey medication? Is it covered by my insurance? Would be pretty obvious questions that'll come up. And then I think most importantly, is this aging friendly? Is this a medicine that's actually appropriate for an older adult? And you will be surprised that not a lot of our providers are trained in managing older adults.
And that's one of the next things that I wanted to ask you about. You are a board-certified geriatric pharmacist, but I suspect many of the pharmacists, particularly in retail, may not be geriatric focused. So what is their level of knowledge coming out of, pharmacy school or whatever continuing education they have? What do they know about the aging body?
It's a great question. And speaking to my own experience, I didn't know much. Now, there are those who may already have an interest in aging, and so they might do a rotation or two in school. Mm-hmm. Your general pharmacist likely is not a board-certified geriatric pharmacist. In fact, 1% of all pharmacists, about 340,000 of us, 1% are even board-certified in geriatrics. So that's a slim number of us. Additionally, it may depend more on their expertise, the demographic. Is it a small rural town with mainly older folks? You will see patterns, and you'll know, even at baseline, if you don't specialize in it, you'll still, as an instinct, as a pharmacist, know what could be problematic.
And by no means do I discount the knowledge that they have or the education they have, because, as I said, I rely on my pharmacist heavily, but I'm not sure my pharmacist is geriatric trained. So, and I'm not sure that many of my physicians really have that expertise. And so I constantly question, yes, that may work for someone in middle age or younger, but what about my parent metabolizing this drug as a 92-year-old? How has that changed? And sometimes I'm not sure they know.
And your instincts are right. It's not just pharmacy, it's the entire healthcare industry. We are lacking in aging trained professionals. So that's why there's more of a movement to aging friendly mnemonics and health system overhauls. The Institute on Healthcare Innovation has rolled out what we call the 4 M's. It's essentially asking what matters most to the patient. How do we preserve mobility? How do we preserve mindset and mood? And then lastly, are the medications aging friendly, or do they interact with any of the three categories I've mentioned? So this new framework, and I think it helps for caregivers to answer this of themselves, is how you guide discussions with your clinical team and ensure whatever we do is aging friendly and appropriate. And it should still come back to what matters most to you and the family.
Right. And I really cannot overstress the fact that what you just said, people must be their own healthcare advocate. They need to have questions when they go in to see a physician or a healthcare team member, be able to articulate what their symptoms are, even if they seem completely unrelated. They may not be, because we don't have the medical training and the background to know whether they're really related or not. And we need to be in there fighting for ourselves, because if we don't, no one else may do that. Now, yes, our healthcare professionals care very much about us, and I'm not suggesting otherwise, but we know ourselves the best. We know what we can withstand, what we, our own history. And sometimes we just don't have the luxury of having medical professionals who know as much about us as we do. So very important to look after our own interests as well. We could talk about this all day long and then some and just scratch the surface of this. But I want to just take a final opportunity as we draw to a close to ask you if you could give one piece of advice to every American family caring for an aging loved one. What would that be, and what's the most important action they can take right now, today?
I would say it's better to plan when there's peace than to plan in the middle of a crisis. And when it comes to caregiving, you're already one of the most underpaid resources in the community, in our health system. Billions of dollars are going unspent because someone's family member is caring for a loved one, and it may feel isolating. It may feel pretty emotionally taxing. My words is to encourage you and let you know that you're not alone, and that there are professionals that might be outside of the healthcare system that can help you navigate this. So lean into those resource hubs, your senior centers. Don't be afraid to find a community of other caregivers. And I'm sure ACAP does a wonderful job of creating that community. Mm-hmm. But I want people to just feel that they're not alone, and that there are people whose whole life calling is to help you figure this next step out. And that's what we pride ourselves on doing. So
right.
If it's medication advocacy, if it's concerns for elder abuse, if it's even figuring out where do we place mom, do we keep her at home or do we put her in a facility, whatever. All of those questions have been asked before.
Yes.
You just don't know it yourself. So build your team up, build your emotional support group, and lean on those people to help you through this. Do not go it alone. That's probably my number one advice, is do not go it alone.
Great. Wonderful advice. Absolutely great. Dr. Canterbury, I want to thank you so much for sharing your time with us today. It's been extremely beneficial to me as both a caregiver and a person who needs care, and just talking about taking care of medications and everyone's needs. And I hope that we'll receive some comments from our audience about things that they took away from today's podcast that have been beneficial to them. So thank you so very much for today. Appreciate it.
Thank you. It's a pleasure to be here.
Great. And I want to thank you, our viewers and listeners. We really appreciate your comments below the video screen. If you were surprised by any of the information that you heard, or if you got one especially helpful tip, we would love for you to include that in the comments section below your video screen. You'll also see video notes below the screen on how to contact Dr. Canterbury's company, Geriatrics, Inc., and how to take advantage of the many services they offer. And you may need to click the More button below, or it'll probably say more below your screen. You need to click that to expand all the notes that are down there for you on this podcast, and they are plentiful. If you haven't already done so, please be sure to click the like button to let us know that this episode was helpful. If you'd like to hear more of our broadcast, please click the subscribe button as well. And you can share today's podcast with your family and friends by clicking that share button and sending it on to somewhere else. We also want to say thank you to Senior TLC, formerly Pace at Home in Newton, North Carolina, for sponsoring our Caregiver Community podcast, and to Every Age, our sustaining partner. Please join us again on Friday, February 6, 2026 for our next episode. If you're interested in in-person programming in your community, we have a rapidly growing number of local chapters who offer monthly programs. You can find more information on that on our website as well. Until next time, be well. Happy New Year. Bye for now.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.